afternoon, everyone. My name is Kunal Modi. I'm Mayor Lurie's Chief of Health, Homelessness, and Family Services. Thank you for joining us here today for this very exciting moment for our city. So without further ado, I'd like to introduce Mayor Lurie.
Thank you, Kunal. Thank you all for being here. Supervisors, thank you for being here. I appreciate it. I want to welcome, although I don't see him, so I'm not going to welcome him, our board president, Raphael Mandelman. But if he was here, I would welcome him. Supervisor Melgar, Supervisor Chan, Supervisor Chen, Supervisor Jackie Fielder, Supervisor Matt Dorsey. 1 month in. Thank you all for being here. This is a really, really important day for San Francisco. About a month ago, I was walking down 6th Street when a group of police officers and firefighters arrived to respond to a corner with heavy drug use. One man named Terry had been using fentanyl when they arrived. The officers instructed Terry and the other men to gather their belongings, and they offered a range of services. It seemed likely in that moment that Terry might enter a treatment program. And when a reporter who was following me asked if he would, you know what he said? God willing. I see interactions like that almost on a daily basis. I saw it with Supervisor Fielder in the Mission last week. And they make me hopeful that we can tackle the drug crisis on our streets. On 6th Street and across the Tenderloin, in Soma, in the Mission, our neighbors need help. And every day, officers and outreach workers offer that help. But what happens when someone says yes? For decades, that person has been back out on the street using drugs a week, a month, a year later. It is a new day in San Francisco. We are going to be a national leader in public health, in behavioral health treatment, addiction recovery, and healthcare access. It's going to take creativity, compassion, and collaboration. And that is exactly what Dan Tsai brings to the table, and I am proud to appoint him as the new director of the Department of Public Health. Dan's career has been defined by a deep commitment to public service and improving health outcomes for those most in need. He has nearly 2 decades of experience transforming healthcare systems at the state and national levels, most recently running the federal Medicaid program, where he helped enroll more people in health coverage than at any point in history. He led efforts to strengthen mental health and substance use care and make public health care systems more efficient and effective. Before that, Dan was the Medicaid director in Massachusetts, leading reforms that improved access to care for millions of people. And before that, he worked in the private sector, designing and implementing innovative models to improve health care for all Americans. He understands what it takes to make a public health system work, not just in theory, but in practice. His experience is broad, but his commitment to patients and communities is clear throughout. Now he brings that expertise and dedication to San Francisco. And in our last meeting, I will say that he walked into City Hall, and I looked at him, I said, can we go walking? And we got up and we walked through the Tenderloin, and seeing him and his compassion right then and there, I knew that he was the right person to lead this department. The work ahead is urgent, and Dan and I agree. We cannot afford to let bureaucracy slow us down. But while behavioral health is critical, it is only part of the mandate. We are going to bring a whole of government approach to supporting providers and the patients they care for. We are going to build on SF General's reputation as a crown jewel of our country's healthcare system. And we are going to be there for the frontline workers in our clinics, like Maria X. Martinez Clinic right here. San Franciscans of all ages rely on the services we provide, and Dan will work every day to improve all of those services. Before I close, I want to thank Dr. Navina Baba, who stepped up as the interim DPH head. Thank you, Doctor. I appreciate it. Thank you for your leadership. And thank you to all the professionals and the entire team at DPH. I'll end with this. Government works best when every department works well together. I've seen it in my first month as mayor, and I know Kunal puts it in action every day as the Chief of Health, Homelessness, and Family Services. When you hear how Dan's former colleagues talk about him as a person and a professional, it is clear that the spirit of collaboration is core to his work as well. The Department of Public Health needs a leader who is ready to break down silos, act decisively, and offer innovative solutions that meet the challenges that we face. Dan is that leader. With that, I'm proud to introduce the new director of the Department of Public Health, Dan Tsai.
Thank you. Thank you, Mayor, for those very kind words. My wife, Kathy, is here, and my boys, Elliot and Ollie. Hello, boys. Elliot is 6, Ollie is 3. Kathy has had to deal with 10 years of around-the-clock public service already, so here we go again. Thank you. And to the Board of Supervisors, I look forward, I don't have all the names down yet, I look forward to getting to know everybody and to working and partnering together and getting some real common sense things done for the city. To commissioners of for the Health Commission, who grilled me for 2 hours in the evening. I enjoyed the discussion, I have to say. It was thoughtful, it was provoking, it was great. I'm excited. I am beyond thrilled, excited, honored to be appointed by the mayor in this role, to be joining this administration, and to be joining the fantastic team at DPH and here in San Francisco with really a stellar reputation across the country. As the mayor said, I've spent my entire career trying to make healthcare better and to better serve people that would otherwise fall through the cracks. And I've spent the past decade in public service at the national and state levels. And this work excites me. It gets me up in the morning when the kids don't. And I love solving intractable problems with the great team, but I also love being able to walk the streets and see people, look people in the eye and understand the impact of what we do and the meaning of it. And I feel that same level of excitement, I think, as I look forward to working with the mayor and the whole team here in San Francisco. And I'm also excited that when I explain to my boys what I do for work, for 10 years now, I've just said, Daddy helps people make sure they can get access to a doctor when they need it, or help whatever their life situation is. And I think the team here at DPH continues that. So I'm deeply excited. In one of my first meetings with the mayor, that walk that you mentioned, with Kunal as well, you outlined your vision for the city and why a world-class healthcare, public healthcare and healthcare system is so vital to that. I asked you some pointed questions. You answered them correctly. But I remember leaving that meeting feeling this tingling sense of excitement. I called Kathy actually afterwards. I was ready to roll up my sleeves, and that's what I feel now. And I'm very privileged and honored to be able to join the team here. San Francisco has such a legacy in public health between the general, the sort of clinics like the one we're standing in now, and staff that really are among the nation's finest. At the same time, there's opportunity to build on that strength and that foundation with new approaches. And we have, I believe, the opportunity to continue to build a world-class premier healthcare delivery system right here in the city that delivers world-class patient outcomes and an experience that every one of us, for ourselves, our kids, our family members, we should want to get all of our care through the San Francisco public health system. Don't worry, Naveed. I'm not saying everyone's going to be able to, but that is the sort of bar. You want the public health care system to be the finest. And we also are here in the Bay Area and Silicon Valley, where there are so many startups trying to solve giant challenges in healthcare. Many of them don't have the ability to focus on the safety net or do things at scale. When you look at what San Francisco has in the public healthcare system, it is unique. It has all the elements. We have the ability to build and pioneer and show both the city and the nation what we are capable of, and that's deeply exciting. And of course, front and center right now is tackling together the opioid and homelessness crisis and making real, tangible progress around that compassionately, effectively, helping the folks on the streets and in this community. There's so much to do there. I'm ready to dig in and roll up our sleeves. And to the staff at DPH, I'm excited to get to know you all, to partner together, and with the community as well. So with that, thank you, Mayor, for this honor. Thank you to all of you. Kathy and the kids, thank you as well. So I'm going to turn it back to the Mayor. Thank you.
All right, happy to take a few questions.
So if folks in the media have questions, just raise your hand. We'll call on you.
Question for Mrs. Tsai. So, congrats. So, I think fentanyl crisis local here is one of Mayor Lurie's highest priorities. So, how will you use your background as a federal director before and also public-private partnership to address this local crisis here?
I think making progress on the fentanyl crisis is priority 1, 2, 3, and 4, and making clear, common sense improvements, making sure people can get access to treatment, that we have sufficient treatment capacity, we have the ability to get people into a whole continuum of care. And I think certainly having moved things at the federal and state level and seeing things as a systems level, that is exciting, and I think I bring some of that. But the work ahead, I would emphasize, it's difficult and it's execution. It's putting one foot ahead of another and making sure we get the building blocks in place to get treatment in place and to get people connected to treatment.
And let me just add, this is where collaboration really is critical, Han. We need all of our departments working well together. Behavioral health, DPH, law enforcement, everyone needs to be working well together, and that's what he brings to the table.
I'm question for you, Director, and then for you, Mr. Mayor. You know, we talk about continuum of care, then the issue of people getting back out onto the streets after going through this rehabilitation process. Are there any models nationally or in other cities that you were looking to that have kind of a good success rate? Because it seems to be a problem that no one has been able to solve.
So I think you're exactly right. And from a federal standpoint, we spent a good portion of the past 4 years debating, working with states and counties all across the country on exactly that. I think there are a few things that are clear. Number one, especially for fentanyl addiction, the path to treatment and recovery, it's not linear. And so folks make forward progress, make backward progress, and the type of clinical capacity and supports we need to be able to account for that and someone being able to move forward and back around that. The second thing that I think that's very clear is, generally speaking, our healthcare system is good at dealing with someone when they are in immediate crisis, let's say a detox, or figuring out how to have someone stably housed, maybe affordably housed, once there's the right structure in place. There's an entire middle piece that I don't think anyone across the country has fully figured out. That's why this is both such an exciting but important and momentous challenge ahead of us that the mayor's really tasked us with. So thank you.
And then Mayor Lurie, with the approval of your fentanyl ordinance, have you started the process of soliciting donors to address issues like this?
Actually, it hasn't been approved. It goes today, I believe, and so it'll hopefully be passed today. We have not approached because the ordinance has not been passed.
Do you have people in mind for once that is approved?
Next question.
Yeah, go ahead in the back.
Mrs. Tsai, can you tell us a little bit more about your background and what is your Chinese name?
Sure. Hi, Mike. Oh, go to Mama. Sure. My Chinese name is Tsai Weiheng. So my Daniel Tsai. I am, let's see, I've got 2 kids, Oliver and Elliot. I was originally born in New York. Don't hold that against me. Spent many years in Massachusetts, and I now live here in the Bay Area. And so I'm really, really excited to be starting on this journey together. Thank you.
Anything else? Adam, last one.
Hey, Mayor, you have obviously set ambitious goals to both expand behavioral and addiction treatment and expand shelter capacity. Has the process for finding locations for those services begun, and where are we at with that? Because
Yeah, Kunal and I are going out and seeing sites, existing shelter locations that we could add capacity to, and additional sites as well. We continue to do that in a number of places. Kunal can get more into that in details, but we're excited to press play tomorrow once this is passed and start reaching out to those that want to support us outside of government. But I also want to really, once again, thank every single one of the supervisors here, all working very well together, including with Supervisor Chan on getting a 10-1 vote. And it shows that we're all aligned, that this is a crisis. It demands us acting with urgency. Dan understands that. He's compassionate, he's tough, and he knows how to get big things done, and that's what we need to do here. This is a crisis the likes of which we have not seen before. I mentioned before, but I'm going to say it again. I walked with Supervisor Fielder in the Mission last week. I went back to the same place today that we walked just last week, and it was not good. We have so much work to do. I am not going to give up. You know, I talk about this every single day. What we are seeing on our streets is not dignified. It's not humane. We have to get people the help that they need. And Dan, I can think of no better leader in this country to help lead the charge. This is, a huge challenge for all of us, and we are getting the right people in place to attack it. So thank you, Adam.
Okay, thanks. Mr. President, want to do a photo? Yeah,